Prenatal care in the United States isn't working the way it should. Too many babies are born too early, costing the U.S. $26 billion each year. Many providers and staff say they feel challenged to give pregnant women all the care and support they need. Given how short prenatal visits are today, it's no wonder patients are often left wanting more.
Just to get more information and more knowledge on having a baby. I have a 3.5-year-old right now, but you know, you don't know everything with even having a first kid. There's things that you didn't learn the first time around.
Time and budget constraints make it hard for providers to give pregnant women the care, education, and support they all need.
There was a lot more education that took place in the sessions than there is a traditional visit. They see me or another provider for about 5 to 10 minutes. And these sessions were a lot longer than that, so there was a lot of education that took place. And one of the most rewarding things for me as a provider working with this group was when these ladies came into the hospital, talking with the nurses at the hospital, they said we could tell a difference in these ladies when they come in. They were prepared, they knew what they wanted, they knew what their options were, and it was a big difference that was very obvious when they came into the hospital. So for me, that says that we did part of what we meant to do with this group.
It's centering, and it's transporting prenatal care into the future with better outcomes for mothers and babies.
Being able to relate to all the different stories was nice. Like every little fear or worry you had, you didn't have to feel different because there was 3 other girls at the same time having that same worry.
Centering combines patient health assessment, interactive learning, and community building. And it all happens in a group space.
I think just meeting such a great group of girls that we've been able to build a support group together even after being done with our prenatal care. We've maintained our friendships outside of the group, and it's been really nice to have that built-in support going into this new chapter of all of our lives.
Also, women take an active role in their prenatal care. In a facilitated group, they learn and share with other women who are going through the same experiences at the same time.
The best part of centering, honestly, is all the friends I've made from this experience. We actually have a little Facebook message, that we message each other back and forth anytime we need advice or try this or try that, and we've even swapped formula, so far it's been a really cool experience.
Women in centering have the benefit of 20 hours face-to-face with their prenatal provider, compared to 2 hours in traditional care. Centering reduces preterm birth at a huge cost savings. Centering also increases breastfeeding rates and patient satisfaction.
Nationwide, this program has a long history of having great success with ladies who are pregnant with better outcomes. So we see a decrease in low birth weight, increase in breastfeeding rates, and decrease in smoking rates. With women who come in who are smoking at the beginning, we've seen greater success in cessation and continued cessation, and then higher breastfeeding rates for women who complete the program. And the biggest thing they found nationwide is lower rates of low birth weight, which are babies that are born smaller than they should be when they're born.
Now, we're seeing centering is not just better care, it's rewarding, fun, and it delivers the outcomes we all want.
The best possible care for mothers and babies truly is within your reach.